We are live now, doctor.
Okay. Thank you. So good evening. On behalf of TNOA, it's my pleasure to welcome all of you to this wonderful webinar where we're going to talk to real life heroes. All of us come across difficulties in lifetime. They can be small, big. So these are three people who faced immense difficulties, man-made, natural, inherent, and each one of these have been daunting. Have been something that can really change your life overnight, and it can make you give up on life and just do something that's much easier. But each one of these are true life heroes which have fought against these daunting situations, difficult situations, overcome them, and bounce back stronger than ever and got to something that is much better. So that is something, the lesson that we need to learn, that difficulties or issues that crop up that create hurdles in your path need not curtail your success or your path. That can be used as a climbing stone or a ladder to reach up to higher levels. And each one of these stories are going to be really heartening and something that's going to be a takeaway message for each one of us. So welcome to this webinar. We have got phenomenal people here. We've got Dr. Chockalingam, Dr. Sri Ganesh, Dr. Atishwar. Each one of them are going to share their path through difficult situations in life. Thank you.
Thank you, sir. Good evening, everyone. Warm welcome to this one-of-a-kind webinar with the Tamil Nadu Ophthalmic Association in collaboration with a wonderful group led by Dr. P.M. Arvind, Fitness for All. Setback is a setup for a comeback. So thank you so much. We have three heroes, as sir said. The thought of this presentation or this program happening 6 to 8 months back, I listened to Sri Ganesh sir and Coscon for about 15 to 20 minutes. It was a high intense adrenaline packed, literally like a Rajnikant movie. It was amazing to listen to sir. I requested sir if we can do a webinar for TNOA. Sir was gracious enough to accept it. Thank you so much, sir. And we have Atishwar and Chockalingam sir. Thank you so much. So we are here to listen to these comeback kings. To moderate this session, we have Dr. P.M. Arvind. Over to you, sir. Looking forward.
Thank you, Dr. Atik. Thank you, Dr. Arun Varman, sir. Thanks to the TNOA ARC for giving us this opportunity, a very unique and a very different approach to actually recognizing ophthalmologists and not just the field of ophthalmology. So I'll just like to start with a quick story about a man from a village in South India who set out to become a gynecologist because he saw the difficulties faced by the women in his village and he wanted to take care of that. But life and destiny, as we may say it, had a different plan for him. It crippled him. He developed psoriatic arthritis. His fingers were unable to do normal deliveries. And it was destiny that led him into ophthalmology. I'm sure by this time you know who I am talking about. It's Dr. G. Venkateswamy, the founder of the Arvind Hospital chain. It's a small example, an everyday reminder of how adversities in life can actually direct us to a new vision in life. And I'm very happy to be able to bring these three real life heroes right in front of you to speak about their life. And you won't believe, unless you listen to their stories, what an amazing journey they have taken. And I really thank you, Dr. Sri Ganesh sir, Dr. Atishwar Das, and Dr. Chockalingam, for coming forth and sharing this story with us today and helping us take a few pages out of your story to help inspire us. If you're having a bad day today, you had a patient, you had a complication, nothing will compare with the stories these people are going to tell you. So put on your seatbelts and get ready. We're going to start. The order is we're going to have Dr. Atishwar Das and Dr. Chockalingam first presenting their stories. And as our keynote, Dr. Sri Ganesh will be winding up with his amazing coming back from a break story. So, Dr. Atishwar, are you ready?
Yes, I am ready very much.
So, I'm just going to give you a quick introduction. Dr. Atishwar is known to us in many ways. He's a great ophthalmologist, he's a tennis player, he's an avid fitness enthusiast. But last year, something happened which literally took him to the jaws of death, and he's back from the gateway of hell or heaven to come back and tell us the story. I really appreciate you coming over here and sharing your story, Atish. So please go ahead.
Thank you, everyone. I hope you can see my slides.
Yes, Atish, please go ahead.
It's in slideshow. Yeah, we can see a slide.
So thank you. I'd also like to thank Arvind and the TNOA ARC for asking me to come and talk. Practically, I think not many would have ever experienced what I'd gone through. My journey is still continuing, whereas others have bounced back successfully. Yes, I'm hoping to get there soon sometime. So for me, it's a journey, a comeback from the setback, which I had a year back. So I was in the pink of my health in August last year when we had this TNOA that I'd participated in the Zumba organized by the Fitness for All group, which is conducting the webinar today also. And I had taken all my health checkups regularly. My treadmill test was excellent. I was playing tennis 5 to 6 times a week in the morning, swimming, doing both strength training and weightlifting as by advised by the enthusiasts in this Fitness for All. I had no comorbidities except being slightly overweight. And then adversity or tragedy struck. On September first week, following the phenomenal TNOA conference last year, I had a fever of unknown origin, which lasts from the last week of August. Got admitted, did all the lab workup, everything was normal. So normal that the insurance refused to pay up for the admission, saying that you're normal while you're getting these tests done. Had an MRI brain and spine. They were also normal, started developing mild weakness of my lower limbs, then persistent hiccups. The neurologist had gone and met him in the OPD, and he said it is post-viral fatigue, and he said you don't have to worry about it. You will get better in a few days because you're young, you're healthy, and have an active lifestyle. However, the next day morning, I woke up with delirium and weakness of both my over limbs. Then they advised emergency admission into the ICU. I was wheeled in directly into the ICU, admitted there, and the dreaded Guillain-Barré syndrome, which we are all worried about, came true. And I had weakness of the lower limbs. Slowly overnight, it progressed to difficulty in swallowing and breathing. Then flaccid paralysis, which started from the lower limbs, went on to the upper limbs. Unfortunately, I had even sensory loss. There are two variants of GBS. One is the motor variant and the motor and sensory variant with axonal involvement. And unfortunately, like fate had it way, I did have the AMSAN or the axonal and sensory variant of this GBS. So they had a very stormy course in the CCU, MDCCU, had quadriplegia, lasted for 42 days, had respiratory weakness and depression, which went in for, I had to go in for tracheostomy. They pumped in me with multiple doses of IV immunoglobulin, which is now the treatment of choice. And I developed autonomic dysfunction. It was so severe that I had flatlined twice. People had literally thought I lost me. They're planning a pacemaker also for sinus brady. But fortunately, with the good team of intensivists, neurologists, and a multidisciplinary team, they were able to revive me and bring me back without a pacemaker. Then there were some bone marrow suppressions during the course. And since I was put on a ventilator, they didn't want to risk any infection. So I had platelet transfusion. And eventually, I did develop ventilator-associated pneumonia, which was treated with high-dose antibiotics. And thanks to the intensivist and the team in the hospital, I was treated, and I could come out of it in 42 days. And they weaned me off from the ventilator. And this is the team of superheroes who are instrumental in bringing me back to life after 2 near-death experience, flatlined twice, like I mentioned, 4 intensivists, 3 neurologists, infectious disease specialist, my colleague from the United States to chipped in, and I had cardiologists. I like to acknowledge it, all of them. And after the ventilator came out, I was trained by a speech therapist or a speech and language therapist, teaching me how to start vocalization, how to start breathing. So it has been a huge difference. Small things which we take granted in life, and suddenly when tragedy or adversity strikes you, and that's when it's a big blow to you. Uh, the normal breathing was tough. I was under BiPAP or positive ventilation, pressure ventilation. Then they weaned it off. Then I had to start breathing. I was never dependent on oxygenation after they removed the tracheostomy, thankfully, because of the intensive spirometry and the pulmonary exercises the therapists were administering throughout my stay in the hospital. And of course, the neuro rehab, which started after I recovered. It took me nearly 2.5 months, 3 months to come back. And once I started neuro rehab, I started improving. This is my picture in the ICU. I was lying on the bed, a quadriplegic, not able to move any of my limbs. I was seeing all these photographs put up by my lovely wife and family just to remind me that still hang on, you will come back. And I did come back because hope is what I always had in mind. And these positive affirmations helped me a lot in coming here. So these are the affirmations put by my family there. My body and mind are healing. I trust my body and its abilities. I'm surrounded by people that love and support me. I keep moving forward with hope and confidence. Thankfully, I didn't have any involvement of my eye movements. I didn't have any diplopia. GBS is known to Guillain-Barré syndrome is known to cause ophthalmoplegia. Thankfully, I didn't have. However, I was a quadriplegic for quite some time. But after the discharge, I started recovering really well. The upper limbs recovered well. And it is the self-determination and personal responsibility which I've taken upon myself, an opportunity to steer my own life. No one else can give you happiness or hope apart from yourself. I know that recovery is not the absence of pain, struggle, or setbacks. I'm a complex human being, and it's okay if I mess up. We all do. So I know that it's painful. It is going to have some setbacks, but I have to emerge stronger, come out of it, and prove that all these superheroes and the intensivists and the doctors and my family who've been there around to see me sail through this journey, which came unannounced. It was unpredictable. So I had to prove them right, and I have to prove them that what they did is worth it. So I am fighting it out. And recovery is still not linear for me. I recovered the upper limbs remarkably well, full strength. The lower limbs are also have recovered, but I'm still undergoing strength training and robotic rehab at Apollo. And it's an explorative voyage for me so far. So a couple of my friends who have been with me have introduced me to this nice book by Ryan Holiday, which says that obstacle is the way. The obstacle in the path becomes the path, and never forget within every obstacle is an opportunity to improve your condition. So this was the basis of the book, and you can see Marcus Aurelius was quoted in this book in the beginning, where he says that impediment, sorry, I couldn't see here, the impediment or the action is the way here. And whatever sets us back behind is the way to move forward. So my journey in the recovery so far, I've done extensive pulmonary function test to start breathing normally, had a speech and language therapist so I can vocalize and talk properly, swallow properly, small things which we always took for granted. And I'm undergoing intensive physiotherapy and robotic assisted physiotherapy with functional electrical stimulations along with IV immunoglobulins. So I'm back here. I started seeing patients in the OPD in my hospital. We do run a NABH certified hospital in Chennai. So I was briefly absent for 6 to 8 months. Then I got back. Happily, I'm seeing patients, but soon I'm going to start operating. That is my determination, and that's the hope. And I think FFA, the group as such, has motivated a lot of people to be fit, and I hope it will definitely make me also bounce back to where other superheroes have been in this webinar. Thank you.
Thank you so much. I think that Atishwar, it was such a fascinating journey, and it's still, I know I'm having goosebumps listening to this whole thing, though we had this conversation before. Uh, Now, will you be available for questions in our interactions, or would you
Yeah,
go for the treatment?
I'm sorry.
Shall we do your
Go.
quest? Shall we
Yeah,
do
sure,
questions right
sure.
now? Will you take questions?
Yeah,
Okay.
yes.
So, Atish, I've seen your 1.0 version, and this is Atish 2.0, right? I can see a completely different person, a very positive person who looks at life in a very different perspective. So, what has this experience showed you? What is different now in yourself, in your perspective?
See, this is a life-changing sentinel event. That's what I would like to say. So no one saw this coming. I'd been very, what do you say, disciplined in my health and fitness as well because of this FFA group. I've been monitoring. I even did a whole body genome sequencing. I think two companies are doing that in India where you can identify what is the probability or the odds or a risk ratio of you developing any of the diseases later in life, be it cardiovascular, diabetes, neurological. So I had done my whole body genome analysis sequencing, and I didn't have any major risk factors for developing any other risk factors. Only thing I had a small risk factor for gout, which was familial again. So I was, but thankfully my uric acid levels within normal limits, so I didn't have to undergo treatment. But this came out of the blue. It was a bolt from the blue. It hit me so hard that I thought I'll never come back or bounce back. But having seen the near ones, dear ones, the friends who are around me, who have been encouraging me all throughout this journey of me to fighting back to life, made me believe that I have to start living my life, the 2.0 for the others, not for me, myself, and being selfish. And that's when I thought I have to definitely put in an effort to see to it that people around me, the people who are closely associated with me and who are in touch with me, I should start living the rest of my life, the 2.0, for them. And I should make a visible difference in their life. And I should definitely see to that I make an impact in their life whatsoever. So that is my learning after this major sentinel event in my life. And of course, to definitely spread the awareness of Guillain-Barré syndrome, which I feel is abysmally low in our country, primarily because it's rare. They say it's rare, but it is much more commoner than we think. After I fell sick, I know at least a dozen doctors who have got Guillain-Barré syndrome in Chennai, who have been through the entire course of the disease and come out of it successfully. And more importantly, there have been a recent epidemic of Guillain-Barré syndrome in Maharashtra, Telangana, and Kerala. So it is fairly common and it can hit anyone, any age, and it can be fatal. 25 to 30% of the time, it can be fatal. It can be worse than COVID as well. But few neurologists did mention that post-COVID vaccine, they're seeing a surge in GBS cases, which is again time to introspect. Are we doing the right thing by blindly taking these vaccines?
Hats off to that perspective, Atish. The
Yes.
2.0 version is also a lot, looking a lot younger and smarter also.
Oh,
So
I've been at home, no
yeah,
sunlight exposure at all.
take care. Do any of the other panelists have any questions for Atish, or we can proceed to Dr. Chockalingam?
Oh, wonderful, Atish. Was a real life-changing
Thank you.
talk that you've given. I think there will be a lot of views from this, and the younger generation needs to listen to this. My take home from your thing is you said that I want to live for others. Well, that was really, really touching what you had said, and really brave on your part to come on a social media platform and tell what
Thank
you
you.
went through for the benefit of fellow doctors beyond ophthalmologists. I think this should reach the whole world. Thank you so much, Atish. It was
Thank you.
amazing having you. Thank you, Atish,
Yeah.
for
My
your.
pleasure. My pleasure.
So, Dr. Chockalingam, sir, are you ready? Shall we get to the next?
I'm ready. I just want to share my slides. So I'll do it and I'll start off slideshow.
Please share your slides and give a brief introduction
Yeah.
as you are doing your sharing.
Yeah.
Atish, you can stop sharing your screen, and I think Chockalingam, sir, can. Yes. So we all know Dr. Chockalingam as a very jovial and a very supportive senior. He's a glaucoma specialist in Chennai, and he's also known for his very strong views on certain aspects. And he's always been a great senior to have. But this is another aspect of the person that we are going to see today. And he's going to share again his personal story. Over to you, Dr. Chockalingam.
Thank you. Thank you, Atik, and thank you, panelists, for giving me this opportunity. And yes, it's I'm going to speak on setback is a setup for comeback. And taking the cue from what Dr. Atishwar spoke, I'm going to speak about two bad episodes in my life, separated 15 years apart. As my mentor, Dr. Arulmozhivarman, said in the beginning, disasters, man-made and otherwise. So I would like to speak about the two type of disasters I have faced in my life and overcome. So I would like to label my talk as my steps in my career as an ophthalmologist to sidestep not so fortuitous missteps. So let us see what are the missteps I took or fate had delivered to me. Difficulties in life can come from any direction, any day, and to anyone, even when you may think all is going well with you. I'm going to speak about, I have no inhibitions in speaking about this now. I'm past 50 now, professionally achieved in my life, definitely achieved something respectable. So I will talk about the first professional death sentence I overcame. I was working in a reputed institute as a glaucoma consultant. See, when you're young, you're sometimes immature. So it was a virtually tempestuous relationship. And that's the time I got a fellowship in a reputed institute abroad in a Southeast Asian country. This was in the mid 2000s. And I got my entire pre-medical checkup done in one of the premier institutes in Chennai, a laboratory chain institute in Chennai, and landed up in Singapore with all my reports. Okay. They had got the test done again, and they declared me HIV positive. And my visa was for 5 days because I went on a visitor's visa. It had not been regularized. And therefore, there was silence the next day. I didn't know what to do. Now, if it's an HIV positive surgeon, it's a professional death sentence. Your moral fabric will not allow you to operate. So I took the next flight, rushed back to Chennai, got all the tests done, everything was negative. Then I was totally in a disastrous position because I had attended a telephonic interview to join in UK and gave up that offer because I had got the Singapore fellowship. Later, I came to know what happened, but that is beyond the purview of this talk. So I was broken, shattered, and running around. Then perseverance is failing 19 times and succeeding 20th time. But the second time I got a fellowship in another institute, and everything was recorded in the interview. And I landed up there, started my fellowship. 3 months into my fellowship, personal problem, a personal problem in my family, a health issue of one of my close relatives, made me to cut back and come back and curtail my fellowship training. What I regret is whatever I aspired to be as a unique person, numero uno person in glaucoma, I could not achieve. And the image was a repeat of a failed man returning home. You know, it's very easy for perceptions to build up. So I was thinking, have I failed even this time? But when you get into the tight place and everything goes against you, never give up then. For that is just the place and time that the tide will turn. And then my professional rehabilitation started. I did spend a good 6 years in a wonderful institute where I learned not only ophthalmology, but also the art of living. And that paved my professional rehabilitation and road to success. Having given up that mad chase behind being someone numero uno in glaucoma, being a great expert in glaucoma, I learned that you have to stop chasing what you love and love what you're doing now. And over the next 10 years, at least, to some extent, to a great extent, I was able to prove all the prepared and purported epitaphs written about me wrong. But life has different plans for you. Another catastrophe happened 2 years back. It was a misstep taken. Here it is not metaphorical, but physical. I have a right leg poliomyelitis since childhood. I've never thought about it myself. Least ever thought that I was a physically disabled person. I had a wonderful schooling, college, wherever I was. I've never thought about it. I've never considered myself about what somebody else would think about me when I walk or the way I do things. But one day, I came out of the washroom in the middle of the hall. I slipped and there was a fracture of the neck of the femur in the poliomyelitic leg. Surgery was done, out of the clinic for about 6 weeks. Then with the walker, because you run the family, run the hospital, pay people. So on the walker for about 6 weeks, 6 months, nothing improved. A repeat X-ray, several consultations. It was said that it was a malunion. So I had to undergo one more surgery. That was in February 24. First one was in September 23. So again, 6 weeks out of practice. Then with the walker, physiotherapy. Now that doubt, a lingering doubt, whether this time I would require a stick or a walker. Now that means again, professionally, it is going to be a big handicap. How would I operate at the theater? And what confidence a patient will have in a doctor who's using an aid to walk around and see the patient. Then intensive physiotherapy and probably I should say the support given by my family made me starting to walk after nearly 1 year. So just before the TNOA, otherwise I would not have come for the TNOA conference last year because it's just difficult to walk with a stick in such a big area. Just before the conference, I was able to take few steps without any aid. But the only difference is previously I used to walk freely. Now I walk with a quadriceps aid. So this fear, whether my profession is again going to close down, is this another God-sent professional death sentence, was always there. But God willing, and I've always felt that in difficulty, something will rehabilitate you. And I was able to come out of it and my family support. And now I'm operating, I'm doing my work. And what I've realized from this is life and time teaches you a lot. Probably I've become more mellow nowadays, and you should be prepared. In fact, this is one stanza from lyrics from a movie for which uh, the great poet Kannadasan had written. வாழ்க்கை என்றால் ஆயிரம் இருக்கும், வாசல் தோறும் வேதனை இருக்கும், வந்த துன்பம் எதுவென்றாலும் வாடி நின்றால் ஓடுவதில்லை. And then he would go on to say, you think you don't have a shirt to wear, but think about people who don't have next day's food to have. So, நினைத்து பார்த்து நிம்மதி நாடு. That is what he has written in that lyrics. So this is what I drew inspiration from. And the greatest glory in living lies not in never falling, but in rising every time we fall. And for all people who think that some people may not ever be successful in life, I would like to tell that success is final and failure is not fatal. It is the courage that really counts. Thank you.
Thank you very much, Dr. Chockalingam. I've never realized this aspect. You never let it come to your face, even when you move with so many of your colleagues.
Sir, can you stop screen sharing, sir, please? Yes, sir. Arvind, sir, please.
So, it's very difficult to share a personal tragedy among a group, let alone on screen with entire state, in fact. So I'm really humbled and I'm thankful that you're able to open up and tell us these things. I just have a very simple question without hoping to sound offensive. But is there a way that people looked at you differently when you go through this kind of a difficulty? Would you wish that people would have been little different in treating you? Can you tell us about that?
Fortunately, nobody has looked at me differently, or I've never experienced that in my life. Till now, definitely not. I should be thankful to God and thankful to everyone around me. I've never seen anybody, even that sense of empathy or sympathy will make you feel little embarrassed. Even that has not been there. So in a way, I've been quite fortunate. The school I studied, the college I was in, the institute I studied, this was not at all an issue.
I'm really happy about that, because sometimes when we are showing some kind of a concern to somebody else, we are actually putting them down also. So empathy and sympathy can sometimes be counterproductive also. I've realized that. And it is actually seeing the person as a whole and giving them the due respect and dignity. I think that is what really holds true. I hope I'm right.
I've never been embarrassed by anybody, put in a difficult situation by anybody. So in that way, I've been fortunate, definitely.
Indeed. Thank you very much, Dr. Chockalingam. We'll keep questions and introductions to the end. Right now, I have the pleasure of introducing Dr. Sri Ganesh, who actually doesn't need introduction in the off-tal circle. He's a superhero even without this presentation. He's a pioneer in when it comes to cataract and refractive surgery. He's somebody who we looked up to even during our undergraduate and postgraduate days. And it's very impressive with the talk that Atik heard in the last Karnataka State Conference. I was also there. I heard this talk, and we are very keen on bringing this to the TNOA platform, especially through FFA, which actually stands for fitness, both physical, mental, and in terms of overall improving the ophthalmologist's lifestyle and perspectives. So thank you, Dr. Sri Ganesh, for spending this time with us and giving us this perspective. I would request you to please go ahead with your talk, sir.
Thank you, Dr. Arvind, and thank you, Arul, for inviting me to give this talk. Of course, it's a non-ophthalmic talk. So there are a few of non-ophthalmic talks which I give, and this is something which, of course, I've spoken about it only once, because I like to just project the positive aspects and never the negative aspects. Even I mean, if life is like that, it comes with its share of burdens and setbacks, and also with its rewards and the brighter side. But I, as an optimist, always look at the brighter side. I don't actually discuss my problems or my setbacks. And yes, people think that it's all nice for him, but it's far from the truth. Everybody has their stories in life, and I would like to share my story. I went through a very bad period for almost 6 months to a year, and then how I was able to kind of bounce back. And this is something. Is my presentation seen? Yeah. So
Yes, sir.
okay, good. So I was invited, I think, about 2.5 years ago to Cordoba by the Argentinian Society to give a talk, and I'd never been to kind of that part, Argentina, and then I'm also an avid biker. I have a lot of hobbies. I play golf. I'm into fitness. I'm also an avid biker, and I have 3 motorbikes, and I've done quite a few international tours. I've done South Africa, India also. I've done Leh, Ladakh, Zanskar, South India, and quite a few motorcycle tours. So I like motorbiking. And then I thought, okay, Argentina is nice, and Patagonia is uh, very popular for its natural parks, for trekking, for biking. And so I thought, okay, I'm going all the way. Why don't I kind of do the trip and go right down to the tip of South America, a place called Ushuaia, where actually they start the journey to Antarctica. And there was a friend of mine, a retired biker, I mean, a retired person from US. And he had told me, anytime you want to do a trip, you don't have any company, you call me and I'll come. And so I told him, see, I'm going for a conference to Cordoba. So why don't we plan a nice 14-day trip and to cover South America? Because Patagonia is beautiful and we can go right down to the tip. And he was all game and he said, okay. So we kind of made the plans, and we looked at the route map, and then it was almost about 4,000 kilometers. We thought we will cover it in about 2 weeks. And we did all the bookings and a lot of excitement. So we started off. Of course, bikes there, you don't get new bikes. They were pretty old bikes. We got the BMWs. There was one company which was able to hire a couple of BMWs, and we started a journey. And then it was beautiful. We started from a place called Bariloche. I flew in from Cordoba, where the conference was. In fact, I had taken all my biking gear, everything. And then I flew from Cordoba to Bariloche. Bariloche is a beautiful place which has skiing, lakes, everything. And then that's where we started a journey. We picked up the bikes, and then we were all excited. And then we we drove via Argentina. And you can see that this is basically the route map, beautiful lakes, mountains, and then this is again a very historic landmark. And the roads there are pretty bad, in the sense that it's either dirt roads or gravel roads, but it's very nice for adventure biking. And of course, it's so difficult even to kind of pronounce the names. And this is one of the famous places where there's a big rock there. And you can see that's that's the bike, and then we were driving. Of course, this is a very old bike. It's a 10-year-old bike. So the newer bikes actually come with all the sensors and the ABS. We had already done, I think I'd done about 1,400, 1,500 kilometers on turtles. Very quite comfortable. And I can just show you some of the landscapes. It's Patagonia is beautiful. You have these snow-clad mountains, you have the lakes, and you can see the dirt roads and kind of deserts. And is the video playing? So you can see that this is
Yes, sir.
just a few of the videos of the place. So it's a very beautiful place, and this is something that I wanted to do all along. I mean, it was in my bucket list to kind of go and see this place and enjoy it on a motorbike. And this is, you can see the gravel road. We just finished, sorry, let me just mute that. So we just finished Argentina, entered Chile. Chile, the roads are very bad. We just stopped. There was a place called Chile, Chilichica, Chile Chico, which is a very small town. And then we stayed, we went there for lunch. We just crossed into Chile, and then we were on our way. And that place is maybe like a population of about 10,000 or something, with like a small PHC. And then this is the gravel road. We were just going there. We stopped to enjoy the view. And then my fellow rider, he came up to me and said that, see, these are all dirt roads. Maybe we should put off the ABS and it'll work better, the traction control and the ABS. So newer bikes, I also have a BMW GS. If you put off the ABS, the front ABS does not go off. You can never put off the front ABS. That's a safety feature. But then I didn't know that about this in the old bike. So I just put off the ABS and I was just going downhill on the dirt track. And then the bike started to kind of wobble and skid. I held the brake, and then the front brake locked and the whole bike spun. I was probably going at about 60, 70 kilometers. And that was actually fast for a dirt road, a gravel road like this. And then the whole bike spun. And then the golden rule is you should never put your leg down when you're on a bike. But somehow, because of panic, I put my right leg down, and the leg got caught between the boxer engine, and the road, and the bike fell on me. And then suddenly I was almost like blanked out. And then I realized there is something wrong. I mean, there was a shooting pain in my leg, and I knew that there was some problem. Meanwhile, I just lay down there because until my fellow rider came, and then he kind of held me up, and I knew I couldn't put any weight on that foot. And he just made me sit by the rock, the roadside rock. And then we checked, we didn't have any signal on our phones. It's very remote. And the problem in South America is very few people speak English. So that's again a problem. And then we tried to flag down. There was a truck that was coming. We flagged down the truck, and then tried to communicate with him in Spanish. We didn't have Google Translate also because there was no internet. But he realized what was the problem, and then he called the ambulance. He said, "Meanwhile, you can get into the truck." They put me into the truck, and then we were going on the gravel road. The ambulance came in, and then I got shifted to the ambulance. Then we went to that small PHC which is there. They're all only junior doctors there, and again they were not able to speak English. So they took an X-ray, and then you can see this is how it was. I had a bad comminuted fracture of the tibia and fibula lower 1/3, and actually it was going down to the ankle joint also. So it was pretty bad. And then I was wearing this boot, and they were all like almost like interns or just after internship. So I kind of I was guiding them in, trying to make them understand in sign language. I told them to take off the boot first of the normal leg so that they know how to kind of remove the boot, and then the boot on the right leg, which was fractured. I think that was one of the most painful things, because on a fractured foot, where if you're trying to open the motorcycle boot, remove the motorcycle boot, the bone actually shifts and then it's extremely painful. So normally they have to kind of cut it off, but they didn't have the equipment there. And then they said, okay, then we are not able to do anything here. Then one girl who was there was interested in orthopedics. And she said, okay, I know something about us. So I said, you just put a slab, posterior slab, and then stabilize it. Then they kind of arranged for me to be airlifted because Chile, the roads are very bad. The roads are so bad that you can't even, shift a patient. So they had to actually call in a small plane and shift me to a place called Cohiaco, which is like a tertiary center. So this was how I was transported in the ambulance. This was after they put the gas. This was how I was transported in the ambulance. And you can see I was put in a stretcher. And that is the air ambulance to Cahiaco. And there they said it has to be operated. I didn't want to get operated there because I didn't know anything or I didn't know their competence also. So they said, okay, we'll put a cast because otherwise you can't travel. They had to put a cast. So they put a cast. This was the cast which they put. And after putting the cast, they have to cut it. Otherwise, you can't go in a flight because then the leg swells up in the flight and you can have a compartmental syndrome. Also, there was a risk of DVT. I had to kind of take 5 flights from Cohiaco. Again, I had to take a flight to Santiago, Chile, which is the capital of Chile, and from Chile to Buenos Aires, from Buenos Aires to Frankfurt, and from Frankfurt to Bangalore. So it took me 5 days to get there. I was actually in communication with my orthopedic surgeon. And then he said, you have to inject yourself with anticoagulants. I was injecting myself with anticoagulants and painkillers. In fact, they actually didn't allow me on the flight, but then I had to because they were speaking Spanish, but then I had to explain that the cast is cut, there is no problem. And I had to show the discharge summary. And even getting the flights was kind of difficult, but my family, my son, my daughters, they were all kind of looking at what are the best options. And I had to kind of book 3 seats in the flight. Sorry, so this was how it was. This was when I reached Buenos Aires. And again, my friend who was there, he was actually from the US, but he said, don't worry, I'll come along with you because somebody has to be there to take you on the wheelchair and also to kind of help you with your luggage and the immigration process and all that. So I was going by wheelchair everywhere. He was wheeling me. I got a pair of crutches also to kind of go in the plane. And there's another picture of me sitting in the flight, but we had to book 3 seats because many of these flights, the shorter flights, did not have business class. So you can't really sit with a cast. So I had to book 3 flights. And then again, the problem on the longer flights from Buenos Aires to Frankfurt was that with an above knee cast, you can't go into that small toilet. So basically, I couldn't eat any food or drink water for almost 2 days because it becomes a nuisance. You just can't also use the toilet in the flight. So I landed in Frankfurt and again took the connecting flight. And then, of course, all this time I was positive because, I didn't know whether I could actually use this foot again or ride or what was the extent. It was a bad comminuted spiral fracture. But this is an award-winning photograph a few years ago, 2021. And it shows, this is a father who has lost his leg in a landmine in Turkey. And he's playing with his son, actually, who has seal limbs. So both of them, have a lot to grumble in life. because he doesn't have a leg and the child doesn't have any limbs. But you can see that still there is some joy in their face. So life is all about being positive. So that is something that actually kind of kept me going, that yes, everything can be resolved and everything will be okay. I just had to take care that I didn't develop any DVT. So I was kind of injecting myself with the anticoagulant and also the painkillers. Pain also was quite high. Yes, this is how it was in the flight. You can see that I had to sit like this with 3 seats. And then I came to Bangalore. I was immediately shifted. And the very next day, they did the surgery. They put a long plate. You can see the fracture is bad. At multiple areas, it is fractured. And they're all small pieces. So they couldn't put, normally when you have a fracture of the tibia, they put a nail, intramedullary nail, so that the rehabilitation is faster. But the orthopedic surgeon says this is lower 1/3 of tibia, and fibula also you have a fracture and it's going into the joint here. So all we can do is just kind of place the pieces and put a plate and screws, and it has to heal on its own, and it's going to take time. And I said, okay. So this is the post-op, immediate post-op picture. And you can see this is almost like a 10-inch plate with a few screws there and fracture. So this is how it was. And I couldn't, he said, you can't put any weight on that leg for 4 months. You can't walk for 4 months. You have to keep your foot elevated to reduce the edema, and then it has to heal slowly. Once it heals, then the bone becomes strong enough to take your weight, then you can start. But again, he said that the lower 1/3 of tibia, this kind of comminuted fracture is very tricky, because the lower 1/3 is notorious for non-healing because the vascularity is quite poor. So they can be non-healing. It may not, the bone may not heal and get used properly. So these are all problems. You may require repeated surgery. But again, I was positive. And but then I wanted to get back to work, because if I'm just lying at home, then, an idle mind is a devil's workshop, because you keep thinking of all the things that can go wrong. Also, around the same time, I had a lot of other setbacks, like apart from the physical trauma, emotional trauma also, because some of the people whom I trusted and who were close to me kind of betrayed me and cheated me. So that also was laying heavily on my mind. But of course, mentally, I'm quite strong. So broken, but not beaten. So then I kind of said, no, I want to go back to work. So how do I go back to work? I mean, I can't go in a wheelchair. If patients see me in a wheelchair, they're going to kind of be hesitant. And how am I going to operate? Because your right foot is the foot that operates the phaco. And they had lined up all these patients for me, because I was on leave for almost 2 weeks. Of course, I had to cut short at half the trip only I was able to complete, and I had to come back. And so these were patients who were kind of lined up, 20 patients, 25 patients every day. And they wanted me only. So I said, okay, let's see how we can go to the hospital and start surgery. So I got this knee scooter, because I can't go on crutches. Even if they see the doctor on crutches also, it is kind of, for the patients, they won't be confident. So I got this knee scooter. And then I was able to put my knee on and then go with the knee scooter. So it was it didn't look so bad. And this is how I was operating. I had kept my right foot on a platform because I had to elevate it. So I started operating 1 week after my surgery. I was back in the OR, and I was operating both the microscope and the phaco foot pedal with my left foot. So, of course, couple of cases, but then immediately I got used to it. So I am kind of ambidextrous. I can operate with the phaco foot pedal with my left I can also do surgery with my left hand. So that actually helped. And I have the 3D system also. So with that, I was able to start work immediately, start operating immediately. And of course, some of my staff used to feel so bad because they were never seen me like this, disabled. And but then, yes, I said, I'll take it as it comes. If I have to operate with one leg, I will do it. And that's how I trained myself to operate. But again, after that, I started developing shoulder pain. And then after a few months, I found out I had a rotator cuff tear injury. So again, I had to it was very painful, left shoulder, and I couldn't even do a 90, 78D or 90D examination. I couldn't lift my left shoulder. And you can see again, I underwent surgery, and you can see that they had to kind of, it was like a mini open shoulder surgery. It was not arthroscopic because they had to kind of cut the um, acromion process there and then open the deltoid and then pull the supraspinatus and put a titanium screw there. So that also I couldn't actually. And the worst thing is, if you can't exercise, again you feel depressed because exercise is an excellent antidepressant. And I've been exercising for as long as I can remember. And not being able to walk, not being able to exercise, you can't do anything. That actually took a toll. And then naturally you put on weight because you're not able to walk, you're not able to do any cardio, you're not able to do any weight training. But then now it's almost 2 years since I had my leg surgery and over a year since I had my shoulder surgery. But I started physiotherapy and I'm back now. I started again, I have a gym in the hospital. So I started and now I'm able to do deadlifts and squats. And also, even after the shoulder surgery, I'm able to do pull-ups, which I was not able to do a single push-up also, but now I'm able to do like 50 push-ups. I'm able to do like 10 pull-ups. So I'm slowly gaining my strength back. And so the thing is not to give up. Now you can very easily give up saying that it's painful, it's difficult to do, I don't think I can do it, and I'm too old to recover. But then the thing is, you have to have that conviction that, yes, I can recover, I will come back stronger. And so I started working out. Of course, today I'm able to deadlift 150 kilos. I'm able to do 10 to 12 pull-ups. And many people ask me, oh, will you sell off your bikes? Will you stop biking? So I said, okay, if you have a nucleus drop, do you stop doing FACO? So no, I didn't stop biking. I didn't sell off my bikes. In fact, I did a few more tours. I did a tour of Italy with my friends, and this was the tour of Tuscany and the Elba coast. So that is something that I enjoy doing. So why give up your hobbies? So I am a diehard. In fact, recently also I was in Chennai and I was on the racetrack, MMRT, and I had some training also, and then I'm back. Of course, I'm getting stronger, better every day, and then hopefully I should be able to get back in shape and look at how I was before I had my accidents. So that's my story and my recovery. Thank you very much for listening to my story.
Hey, Ganesh sir, this is the second time I'm listening to this presentation, but it's still so exhilarating. It's inspiring and raises goosebumps every time you take us through your positive attitude, your broken but not beaten statement. Uh, Hats off to you, sir. And in fact, I could feel the pain when you said, you're taking off the boot or traveling in the flight was 3 seats, not being able to take a bathroom break, and having to curtail food and water, and actually coming back, going through surgery, and sitting through cataract surgery after that. That was immense. Thank you so much for bringing in this entire story to the listeners of the TNOA ophthalmologists. And I'm sure a lot of us will take inspiration and hit the gym tomorrow morning. I don't think even now we can do 150 kgs deadlift without fractures also. So that was very
Now,
nice of you to share this.
if you want to find excuses, there are thousands of excuses not to do a thing. But if you
True.
put your mind to it, definitely you can. And like I said, you should be strong enough not to let excuses come into your way. Whether it's a fracture, whether it is an injury, you can always bounce back.
Absolutely. I just had one question. So, anywhere during this injury or during its recovery, do you have this question of why me? Sometimes we tend to feel life is unfair to us, and that we have been doing everything right, but something out of the blue hits us. And this is an open question. So, sir, and to the other two speakers, have you ever had this feeling, why me? And how do you go about handling it?
I mean, life is like that. Life is always full of ups and downs, and there can be contingencies. It's a very fluid situation. Things can it can change overnight. It's like a battlefield. Life is like a battlefield. Suddenly things may change, and you have to adapt. There is no question of asking why me. Everything will happen to everybody. Okay, it's not, was I at the wrong place at the wrong time? I mean, it can happen to anybody. You always ask that question, oh, if I had not done that, this would not have happened. But the thing is, that is part of your journey. Suffering is a part of mankind, and you have to accept that. Life is not perfect. Life is not always the same. Things will change. But as long as you're living, as long as you're breathing, as long as your heart is beating, you're still in the game. So play the game the best you can and don't complain. Because if you complain, then there is no point. Complaining will not help. So having a positive attitude and saying, okay, what can I do next? And how can I move on from this is what we should all learn. And that's why I put up that picture of the one-legged man who was playing with his child. And you can see that they have everything to complain. But you can look at the joy in their faces. Still, they are smiling. So if people like that can smile, why not us?
Absolutely, sir. Thank you so much. There's also one thing I wanted to ask Dr. Chockalingam, Dr. Atishwar, if he's there online. What about the role of family? How much did family pitch in, and what is their role when you are going through adversity? I'm sure they're a big support, but your thoughts on that?
Yeah, this definitely I would like to address. Both the episodes. The first time I spoke about my foreign venture and the fiasco which happened. Professionally, many people had written me off. My peers, my colleagues, the so-called superiors under whom I worked. I mean, nothing personal now against anybody, but people thought, okay, this fellow is an unstable guy. He doesn't stick anywhere. See, he's gone abroad, he's come back twice. What has he achieved? But they see, you cannot go and explain all these things to everybody, all these difficulties. Now I have no inhibitions at telling. But that time, today, I have both my kids also along with my wife behind me. That time it was my wife who was rock solid behind me. In fact, my close relatives used to tell me he gave up the job in a premier institute. Foolish thing he did. He should not have come. What has happened? He spoiled his, let me say, he spoiled his name. This is what they said, my close relatives. But my wife was rock solid behind me. She said, I've seen what all you've gone through. Okay, if this door is not open, something else will open. That's what in my clinic also, when you enter my clinic, I put a big billboard there. Stop chasing what you love. you love what you're doing now, you will succeed in life. And today I'm known as a glaucoma specialist. I do glaucoma work, but I don't do all the new form surgeries, advanced surgeries. I've lost the track in the training, of course. But at the same time, my phaco skills have improved a lot. And I do all types of phaco and I mean, so which was not there 10 years back. So and this time during my fracture, the surgery, first time it was a nailing, second time it was a plate. The whole family was behind me. My son was in 10th standard when I had fractured my leg, but still he also kept strong, scored well. And still I love long distance driving. Like sir, like trekking, I would like to take the car and I've touched 150 kilometers per hour on my car. Okay, I love long driving, which I even do now. So it has one thing about you were asking, sir, about why this is happening to me. I used to have this feeling when I was at least 20 years younger than now. But I think age makes you experiences. One of my senior consultant, Shankar Nethala, used to tell that um, when a sculpture sculpts the stone hard, the stone will feel it is taking too much of beating, but it is getting sculpted to the finest level. So that is what that is what life's experience teaches you. So be prepared. What I've learned now is anything can happen any day. If I have to liken our life to a script in the share market, you don't know when it will crash. But what has experience taught us, age has taught us is be prepared for that. Anticipate and accept it with whatever your hands to overcome or tackle that situation should it arise.
I have a question for Sri Ganesh, sir. Sir, I mean, the talk in COSCON, you were saying that you started training and doing exercises ever since college days. You said you used to play basketball during college. You used to be very.
Yes.
I've never remembered any talk better than this. The talk which I heard last time, I forget, but yours I remember because of certain personal things. I was down that time, and your talk made a difference in my life personally. So my thing is, sir, see, I listen to you, I feel motivated. Tomorrow I feel I have to do something. But after a week, it gets boring. Something else comes in and I find reasons. How do you keep going, sir? I'm not talking about this journey now in the past 3 years. From your college days, I mean, I've been following you on social media. How do you keep track of things and how do you keep going continuously? Don't get bored about this. That is my question to you, sir.
Do you get bored brushing your teeth or having a bath every day? No, no. It has to be done. So exercise and your nutrition also is something like that. It is self-discipline. Nobody has to tell you. You have to be disciplined. You have to do it. So there are many times when I feel tired. There's some days when I do 50 surgeries and I'm tired. I come home, I don't feel like kind of exercising or going for a walk. But then I tell myself, you will feel better if you do it. And then when I do it, then I feel better. So there are some days when you're exhausted, but this is actually refreshing. And exercise is a stress buster. And the thing is, if you're not overweight, if you don't have any BP, sugar, or anything like that, if you're healthy, you can also recover. Even if you have an injury, you can recover very fast from your injuries. So that's what helped me also. Because even the orthopedic surgeon was surprised. He said, while I was drilling your tibia, I thought my bit was blunt because the bone was quite dense. That's because I've been doing weight training, and so naturally your bones are stronger, they heal better. You're able to recover from your injuries. And there were bad injuries, and I mean, taken me quite some time. I've not been able to run. I just started running. In fact, just past 15 days, I've been doing some kind of cardio. So I want to get back to what I was before the accident. So, and be better than what I was. So that's the inspiration will be there only for a few days. So you can't depend on inspiration, but it is self-discipline. I mean, if you develop good habits and you think that it has to be done, that is your way of life, then you will practice it every day. So you have to be self-motivated. And that is very important. Many of the doctors neglect their health and they give it the last preference. But that is something I think if you cannot spare like half an hour or 45 minutes a day for yourself, then what is the point? See, your surgical instruments also, you clean it every day. No, you maintain it. If you don't maintain it, it will not cut properly. It will not work properly. The body also is a surgical instrument. So it has to function properly. You need to maintain it. And if you do that, then it will, in the long run, I mean, health is wealth. Health is everything. Without health, you cannot enjoy life. So that is something that everybody should realize. And as doctors, it's much more important. We practice what we preach to our patients.
A lot of quotable quotes today. And you'll have to probably watch this video again, write this down. And like Atik said, after a week, when we start weakening our resolve, we have to see these things again and strengthen our resolve again. So, thank you very much, sir. It was, again, a very nice experience. Although Dr. Atishwar is not there, I would like to recognize the role of his family, his daughter, his wife, and the rest of his family who stood like a rock behind him through his recovery, saw him go through really difficult times, but still get the clinic and the hospital running, and saw to it that Atish saw the positive side of life and brought him back fighting. And these are stories of the human spirit, I think, eventually, which really inspire us to take our mundane lives to something more than what it is, to some better heights. Thank you. And I think, shall we wind up? Do we have any other questions?
Yes, sir. We'll wind up, sir.
Sure. Thank you.
Thank you. Thank you very much.
Thank you, sir. Thank you so much.
Thank you. Thank you.
Thank you. Good night.
Good night, sir.
Good night.
Good night, sir.